Okay, it's 5 minutes past 9. Dr. Ibrahim, I think we can start, right?
Yes, you can start. Yes.
Okay, thank you so much. All right. Good evening, everyone. I am Flight Lieutenant Pharmacist Ibrahim Mohammed Amidu. I'll be your moderator for tonight's session. Welcome to this important session hosted by the Drug Information Pharmacist of Nigeria, a specialty group of CPAN. The Drug Information Pharmacist of Nigeria is a specialty group under the Clinical Pharmacist Association of Nigeria. DIPAN is committed to enhancing patient care by providing healthcare professionals with accurate, evidence-based drug information. Our key objective is to equip pharmacists and other healthcare providers with the knowledge and tools needed to make informed decisions in patient care, thereby improving health outcomes across the nation. Please, before we proceed, let me go over a few housekeeping rules for our session tonight. Please ensure that your microphone is muted during the presentation to avoid any background noise. If you have any questions during the presentation, please type them into the chat box. We will address them during the question and answer session after the lecture. If you have or experience any technical difficulties, please use the chat box to inform us, and someone from our support team will assist you. As it is customary, I would like to invite one of our participants to lead us in a short opening prayer. So please, can anyone just unmute and lead us in the opening prayer?
Okay, in the name of Allah, the most beneficent, most merciful, may Allah subhanahu wa ta'ala guide us through this our discussion tonight, and may we benefit immensely from the knowledge that will be shared to us, and may we impact and use the knowledge for the betterment of our society and to impact and to improve our knowledge in patient care. Thank you very much.
Thank you, Ahmad Sanusi, for the opening prayer. So I would like to officially welcome everyone to this session on PubMed for Clinicians, Find the Best Evidence to Guide Patient Care. It is my honor to recognize the CPAN National Executive Committee members led by Dr. Joseph Madu, FPSN. We appreciate the leadership of CPAN. I want to recognize the Drug Information Pharmacist of Nigerian Executive Committee led by pharmacist Mrs. Folashade Lawal, FPSN. Thank you for your dedication and effort in organizing this session. We are pleased to have with us members of Drug Information Pharmacists of Nigeria and other distinguished attendees. Your presence here tonight is a testament to your commitment to enhancing patient care through evidence-based practice. Let me take a moment to also acknowledge our esteemed fellows of the Pharmaceutical Society of Nigeria. Additionally, we recognize the fellows of the West African Postgraduate College of Pharmacists and fellows of the Nigerian Academy of Pharmacy. We are also honored to have with us tonight some of our professors and lecturers. Your continuous contributions to the advancement of our profession are invaluable. Now, it is my pleasure to introduce our distinguished speaker for the evening, Dr. Tarile Temide Asogwa. Dr. Tarile Temide Asogwa is a highly accomplished clinical pharmacist, researcher, and educator with over a decade of professional experience. Currently, she is a PhD candidate in pharmaceutical health outcomes and policy at the University of Houston. Her work has been published in numerous peer-reviewed journals, and she has presented at international conferences, showcasing her expertise in real-world evidence generation and health service research. Dr. Temide Asogwa is also recognized for her contributions to healthcare delivery and policy development in Nigeria. She is dedicated to advancing research and teaching in the field of pharmacy, with a particular focus on improving patients' outcomes through innovative healthcare strategies. Tonight, she will be guiding us through the topic, PubMed for Clinicians, Find the Best Evidence to Guide Patient Care. This topic is indeed crucial for all healthcare professionals who are committed to providing evidence-based care and improving patient outcome. Without further ado, I will hand over the session to Dr. Temide Asogwa. Dr. Temide, please, the floor is yours.
Hello, Good evening, everybody. Can you all hear me? Can one or two persons
Yeah, good
confirm?
evening. Good
Okay,
evening, ma'am.
thank you. Thank you so much. I guess it's not on full screen yet.
Yes, it's not on full screen yet. You
I
can
guess it's
reshare, yes.
now on full screen. Okay. Thank you so much for having me. Really, really excited to be here. Thank you, Dr. Bello, for, the opportunity. I'm always excited to be in the midst of my CPAN people, drug information pharmacies, anything pharmacy in Nigeria, is my thing. So thank you so much for having me. Okay, so today we are going to be talking about the topic PubMed for clinicians, find the best evidence to guide patient care. We are going to be looking at three basic evidence for objectives for this presentation. First, we want to understand the importance of evidence-based practice. We had a presentation some time ago that, we talked about that from the CPAN diaspora group, so we won't dwell so much on it. We'll just touch base on that. And then we'll learn how to effectively use the PubMed clinical search. And we will translate into like gaining practical skills in how to search and optimize the search, as well as generating reports of the findings from the search. So you may need to grab your laptop and get ready, because we are all going to be doing this together. They said doing is the best form of learning. So for the purpose of this presentation, we're just going to go through this outline from the introduction. We talk a little bit about the overview of PubMed and how to optimize this search. We'll also get into the practical demonstration, like I said earlier, and when we get the reports, how do we interpret it and possibly export that report to other colleagues or collaborators, and then we'll conclude and take questions and other discussions if possible, if available. So PubMed is really a free resource developed by the National Center for Biotechnology Information. Some of us may have been seeing the acronym NCBI. That's what it stands for. So that is the umbrella body of NCBI is the National Library of Medicine. So it basically provides access to a vast database of biomedical literatures essential for evidence-based clinical decision-making. So today we are just going to explore its key features, including how to access abstracts, full text, and also how to effectively filter these search results and use the advanced search tools. So let's start by understanding what is PubMed. Like I mentioned earlier, it's a free online resource developed by the NCBI. And it has a vast database of references and abstracts on life sciences and biomedical topics. It's very essential for healthcare professionals. Of course, that's why we're talking about it. Also for researchers, virtually every healthcare professional is a researcher as well, and for students as well. And it offers a very broad scope of biomedical literatures. Covers about or over 34 million citations, including those from Medline, life science journals, and other online books are all, in this PubMed platform, which makes it very powerful. So one great feature about this PubMed is that it often include links to the full text or articles through the PubMed Central or the publisher's website. So it's like a one-stop shop for everything. And also the best part of it is that it is freely available. So by the time we go into doing the practical steps, every one of us would have to just, open it up as long as you have internet connection. And, that makes it really indispensable for finding credible and up-to-date information in the biomedical field. And that would help us to support our clinical decision making. Moving forward, we would now talk about why it is so important in clinical research. So as clinicians, we often rely on evidence-based medicines to make informed decisions that can affect, or often, of course, affect patients' care. And PubMed plays a critical role in this process by providing us with a quick access to reliable and up-to-date research, that will help us support that decision-making process for our patients. And one of the strengths of the PubMed is its comprehensiveness. Like I mentioned earlier, it covers a vast repertoire of peer-reviewed articles and clinical guidelines, systematic reviews, meta-analysis, a whole bunch of studies. As we go through it, we're going to see everything that PubMed has to offer. And it has a global reach in that any article that is published, as long as it's available on PubMed, you can see it even the next day. So, and also it's continuously updated. So we always have access to the most recent or current information, which is really important for us as healthcare professionals. Because we know that, guidelines rapidly change, and in order for us to understand, the new approach to treatment and things like that, PubMed is very, very indispensable. Let's dive into some key features of PubMed that makes it so useful for us clinicians. First, we have the abstract, which we all know is a summary of articles that provide the overview of the study, including the purpose, the methodology, the results, and the conclusion. So why the abstract is really important. It can help you, just like having a snapshot of the whole study, to have a very quick, overview of the study and find information very quickly. We also have the full text. So links to the full text version of articles are provided when it is available on PubMed. So we have access to that, and we'll see that in a little bit. Also, we have access to filters while using the PubMed. It has the features of filters where you can filter by the type of article. Do you want clinical trial, review articles? You can do filters by the publication date, kind of language, if you want only English literatures and things like that. So it really helps us to narrow down our search to really optimize that process and help us to get the best possible results from the search. And also there's also a feature of the advanced search option, where we can use what we call the Boolean operators and mesh terms and other tools to really help us, have very specific information from the search. So in order for us to understand how to optimize search using PubMed, we are going to learn about the Boolean operators or not. We'll see how to use them. We'll learn about how to use the mesh terms for more accurate searches, and then how to apply filters. So looking at the Boolean operators, so these operators are really essential tools for refining the search on PubMed. There are three primary operators: and, or, and not. So first, let's look at the AND operator. The AND operator just really helps us to narrow the search by including results that contain all specified terms. Like, we're going to see examples. So if we want to say something like hypertension and diabetes, so PubMed will only show us articles that mention both hypertension and diabetics together. So this is useful when you want to like combine different concepts to ensure that all of these things are addressed in the same article. Then we have the OR operator. While the AND operator helps us to narrow down, the OR operator helps us to broaden the search. Like, we can have hypertension. Some authors may call it high blood pressure. In order not to miss out on any of these articles, we use the OR operator to help us broaden the search term. Then we can also use the NOT operator, which excludes the results that contains specific terms that we would specify. Let's say if you want to say hypertension, and then you want to exclude preeclampsia, like hypertension in pregnancy, we can use the NOT operation so that we are sure that every article that is presented is for primary hypertension, doesn't preeclamptic patients. So moving forward, we are going to talk about the MESH terms. So MESH actually stands for medical subject heading. It's just like a specialized kind of vocabulary that is used by PubMed to index articles. And it uses standardized terminologies to ensure that there is consistency across similar topics. So this really helps to increase the precision of our search. For example, rather than searching the term high blood pressure, we could use the MESH term hypertension slash therapy to specifically target articles about the treatment of hypertension. So this really avoids variation of terminologies that may include irrelevant articles or that may miss out relevant articles. So to use the MESH terms, you can either search directly on the database by adding the word MESH, or there is a platform on the PubMed site that we will see later on how to do the MESH term. Okay, so next we're just going to talk about how to apply filters. These are we're just like prepping the ground to delve into the practical aspect, but I thought it is important to just like mention this quickly before we get into the items. So that will be like the repetition of what I'm saying already. So these filters, basically we have different filters. We have filters for date range that will help us, optimize the search to just be confined to maybe very recent articles, 1 year, between 1 to 5 years, and things like that. Then we have the article type. Do we want to look at clinical trials, reviews, practical guides? That's very important for us as clinicians, so that we just limit it by the filters and directly get into what we're actually looking for. And then the language, because articles are written in other languages, we can just restrict it to English. And we would see where and how to apply this when we get into the interface for PubMed, actually. So we're going to have a live demonstration. And I'm going to be switching my screen. If you see me looking, I don't know if my eyes are looking this way or this way, but I'm using 2 screens. So pardon me if I'm not directly looking at the screen, or the camera rather. So we're going to look at an example case for searching hypertension treatment guidelines. That's, very popular disease that we all can relate to. So that was why I picked hypertension. And then We will look at how to optimize using the Boolean operators, mesh terms, and the filters. So afterwards, after doing the practical demonstration, we're going to look at reporting and utilizing the findings that we get, like how to export these findings, how to incorporate them into clinical practice and things like that, how to save the reports and all that. So at this point in time, I am going to pause here for a little bit and switch my screen. Let me know if you see the PubMed screen. And I will crave indulgence to all open browser. If you use Google Chrome or Edge, Firefox, whatever, I use Edge on my PubMed. So I'm just gonna reshare the screen. I'll stop and share again. Just to be sure that we are all on the same page. Can we maybe put in the chat or indicate if we are ready for this practical section? Thank you, Dr. Ojo. Okay, I see. Let me say we are ready. So, okay, let's dive into it. I'm going to reshare my screen. Okay. Okay. Can you all see my screen fully?
Yes, we can.
Thank you. Trying to navigate this whole two-screen thing. Okay, is it still showing?
Yes.
Okay, so do we all have PubMed opened up? I am just gonna put the link. Sorry, I have it in the slides, but I think it will be easier to just put it in the chat so people can have it hands-on. Okay. Okay. So let us begin by searching for the term hypertension treatment guideline. I'm going to, okay, hypertension Please feel free to interrupt me if you need me to go back or anything is not clear. Okay, if we're all following, I'm going to hit the search bar. And we can see the results that came out. I know some of us will already be familiar with this, of course, but just for the benefit of maybe young researchers or people that might not be so conversant with using this, I'll just go over this. It might not be a big deal to some of us, so for the purpose of learning, let's just run through it. So hypertension treatment guideline. Now we can see here the articles that popped up. Do we see number 9? It's not in English. I don't know how we can make this more interactive, but I would like it if people are dropping a word or two verbally, because I'm not really even looking at the chats. since I'm demonstrating. So do we have the same thing? Does it look similar to what I have here as what you have on your individual
Good
computers?
evening. Good evening, our presenter.
Yes, ma'am. Good evening.
Okay, so what I have on my screen is similar, but probably not exactly, and that is probably because of the location. It's possible that what is coming to us in Nigeria is going to be different. For example, you have ACVIM consensus statement guidelines as your first reference. But for me, I have 2017 ACC/AHA AAPA ABC guideline. Okay. So
I see.
Mm.
Okay.
so that
Good
will
evening.
be influenced by the
Yes, ma'am.
location.
Yes, I
Yeah.
think so.
Good
Okay.
evening.
Okay.
Yeah. Good evening. Okay.
For me, I think I have the same thing as she does
Okay.
because she filtered it out to open, I think, free flow tests. So initially, I had what Dr. Ojo had, but when I did the
Yes.
filtering, I had exactly what she had, 3,514 results rather than
Okay.
9,000 plus that I had before.
Awesome. I just cleared my filter since it's the first phase, and I think I have the same thing as what you all have.
Yes, we have the same
So
thing now.
yes. It was me having a filter there that I've always kept there. Okay, thank you. I appreciate the participation. So next, we are now going to use the Boolean operators. Now we review the articles. Please be taking note of the numbers. Like now, without any filter, we have 9283 results. I just want to for us to really recognize that it really helps to use all of these advanced search terms to narrow it down or broaden it, as the case may be. So now we are going to use the AND operator. So we have to refine our search query to hypertension and treatment and guideline. Can we do that? We just add and in block letters to each of these hypertension and treatment and guideline, and then we click on search again. Do we have that? So this did not really affect our results, but it's just ensuring that all of these are present in the search. Okay, since we don't have any filter yet, we still have our 9283. At this point, you may want to just scan through, but we really want to go down and see what we can do, to narrow it down. Now, because it's possible that we can miss out some articles, I may not use the term hypertension, or maybe rather use the term high blood pressure. We would now try to expand the scope to accommodate those kind of articles if they exist. So what we would do is to ensure that hypertension is put together with high blood pressure. So we are going to include the term hypertension. We put them in parentheses. So we bracket open hypertension, or remember all the Boolean operators are in capitals. It's just one space. Or high blood pressure. And when we say high blood pressure, we have to put it in inverted commas in order for it not to identify high blood pressure. So we will do high, oh, sorry, I need to leave them in lower cases. High blood pressure. And then we close the brackets. Are we all up to this point?
Yes, we are.
Okay. So I'm going to do the search again, not the results, number of results. So we have a slight increase, very slight increase from 9283 to 9351. What this has just done is to include articles that may have referred to the term hypertension as high blood pressure, and the articles are also related to treatment guidelines. Now, the next thing we are going to do is to include, remember what we said and what I mentioned during when I was on the slide. You can use not to exclude some patient population. So we can say not pediatrics in order to exclude pediatrics. So we would use the we would say not here, not pediatrics. Be careful, like the spelling of pediatrics. I know UK and the US spell pediatrics in a different way, so I am using like the US spelling, pediatrics. Some people spell P-A-E. Okay, are we all there? I'm gonna hit the search button now. Pediatric. Okay, so what we've just done is we have searched for articles related to hypertension or high blood pressure that talks about treatments and guidelines. And we've gone ahead to filter out every article that is related to these terms that we've searched for and filter out the ones that are related to children, which is pediatrics. Note here that the number decreased again from 9351 to 8798. So that is some bits of optimization that are taking place to be sure that, okay, we're looking at primary hypertension just for adults. Okay, is there any question at this point? Do we all have like the same thing still on the, you can just share your experience so far, one or two persons.
Okay, thank you very much. So far, we are having the same thing here with me here. I also have 8798 when I included the not pediatrics option as a Boolean operator. Good.
Okay, thank you so much. Thank you. So we could, at this point, filter out our results. We could just try it. And then before we move to using the mesh terms for more precise and accurate search. So at this point, we see that the articles range from 1975. That's such a long time ago. They are obviously not totally irrelevant, but we can be making current decision based on 1975 articles. So you can just use this button to move it to, let's say, 5 years ago. That's 2019. Okay. So if we want only articles 5 years ago, like from between 2019 and 2014, then we have just 2085 with the filter of the dates. Okay. So if we want to just include just 2023 to 2024, the results are even more streamlined. So 536. And now if we want to say, oh, let's just look at the type, let's filter by the type of article, for instance. So do we all have these filter bar here? We can say we need free full text article, meaning everything that appears here, you can actually download it for free. If you say full text, it will include both the ones that you need to pay for subscription of the journal before downloading the full text. So, I mean, most of us do free, obviously. So I always have it on free full text. So we can see that the results are further streamlined to just 293, which makes it easier for us to like scan through. We can even go ahead to say, okay, maybe we should just look at review articles or systematic reviews because we want to see, how does this guideline compare, So articles that have like collated different guidelines or something together, we could choose to do that. Like, I mean, just pretty much anything. You could be looking at randomized control trial because you may want to make a case with a physician to say, oh, the latest trial that did check for this treatment for hypertension in people with kidney disease or something said these were the results, and based on that, I'm making this recommendation or something like that. So you can say trials. Oh, when we said trials, we have just 15 results. Isn't this so precise? We can go further to, take it out of trial and say review articles, or we say abstract if we want to do like some quick search. We can say abstracts only. So you see we have more abstracts. That's obviously because some persons publish their abstract before they publish their full text. And sometimes the full text may not be on PubMed yet, but the abstract is already indexed on PubMed. So, I mean, we can just pretty much play around this. And now, okay, what we do with results now, let's assume you just want to take one of these results. You can just click on it and see if it gives you what you're looking for, or use the search terms to make it more and more precise until you see what you're looking for. I saw one article here that, okay, so we can say additional filters, right? When we say additional filters, these are like all the possible filters we could add. It's even a more precise or advanced way to search. We can filter by, if we say order, for instance, exclusive print, midline, okay, article type, species, okay, human, animals, article language. I don't think this will affect it too much, but we can just choose English because I think this is already optimized to act in the English. But I think there might be an article or two. I took note of the last set to 18. So let's see if there is any reduction if we apply the language of that. Okay, 512. Did anybody notice if there was a decrease in the number of search results? I think we had 5, 3, 6 something. Did you notice a decrease at your end? Let me see. Oh, so there is really no non-English article listed here. Let's see for free full text, 286. And now let's see if we add the filter for this moved again. Okay. Let's see if we add the filter for the language, because I think I saw article language. I hope I'm not moving too fast.
No, you are moving okay. It's okay.
Okay, thank you.
You are
Thank
good.
you for confirming. Okay, let's see if it changed. 536. So pretty much there's no change when we apply the filter. So I'm just going to go ahead to clear all filters, just to reset all filters as what it was before we started including the filters. And we see that we had our 8,000 plus result again. So we're just going to move forward to see how to use the mesh terms. Mesh terms. Okay, so the mesh terms really. Is my screen still showing?
Yes, please.
It's okay.
Okay. I just need to be confirming. Please, if there's any weird thing happening, just please draw my attention.
Okay, noted.
Thank you. So we're just going to move ahead to see how to use mesh terms to further make our search more and more precise. So the mesh terms actually stands for mesh, medical subject heading, I think. Yes, medical subject heading is what mesh stands for. So PubMed uses this system to organize and categorize medical research articles. So just think of it like standardized keywords, right? That helps group similar topics together. So in that way, you're able to more easily find all the relevant information on a specific subject. So why do we really need to use the mesh term? It helps us to be more consistent, like the language, It helps us get more accurate results. It also helps us to get very organized results in our search, and pretty much makes it more precise and accurate, basically. So we are going to use the mesh term now. If you scroll to the bottom, do we see the mesh right here?
Yes.
Yes.
Okay, so we click on mesh and allow it to open. And now, still using our hypertension treatment guideline example, we are now going to search for the term type hypertension. Just type hypertension and press search on this search button. Note here that right here, I hope you can see my mouse. Right here you see is mesh. So since we are medical people, we are like trying to just streamline it to the medical subject heading for all of the benefits I had earlier mentioned that the mesh search helps us to get out of our search. So let's just type hypertension. Okay. So this gives us subject headings related to hypertension, white coat hypertension, intra-abdominal, pregnancy-induced hypertension. Can we say some of the results we have on our end, like the kind of hypertension, just to be sure we are following? What else do you see apart from the white coats and all that?
Intracranial hypertension.
Okay. Okay.
Idiopathic non-chronic portal hypertension.
Okay. Thank you for confirming. So what we do here, note that this is showing here as a mesh term, hypertension. So this is telling us that it's using this as like a text word, or do we call it like keyword, medical keyword, to do this search. So now we would now review the list. We saw all of those things we all mentioned and look for like related topic like hypertension therapy or hypertension diagnosis. And then we will click, let's say we want to pick hypertension diagnosis or something. Or let's say we want to pick essential hypertension. Okay. We pick essential hypertension. Now, are we all on the same page? So
yes,
we can, okay. We can now click add to search builder. Do we all have essential hypertension added to search builder? Hello, is it added?
Okay, not yet. We're trying to add it.
Okay. So essential hypertension appears on the PubMed search builder here. If you click on this button saying add to search builder.
Yes, it's now added.
Okay. So the next step, we could say like combine the mesh term with other search term like essential hypertension and guidelines. So we could add here and in block letters and guidelines. Guideline. And guidelines. And then we hit on search PubMed. I want to be sure we're all to get on the same page before I hit the search PubMed button.
Yes, we are on the same page.
Okay.
Yes, we are.
Yes. So, I mean, who noticed something about this search results based on like comparing from what we did before without using the mesh term? Does anyone want to unmute and say if you noticed something? Anything at all?
Yeah, actually, in all the search results, there is the mention of guideline. Almost all the search results that came out have this element of keyword guideline in them. That's number one. And number two, in the left-hand corner of the page that's displayed, there's one chart showing the date and also the results. The results are very few. We have just 2 pages, page 1 of 2. That's very, very concise and precise. It's precise and definite and easy to
Awesome.
refer.
Yes. So in mine, since mine is restricted to like, so you can imagine like between 2015 and 2024, when we use the mesh term, we have just 18 results. So it has really narrowed it down and it makes our search more efficient. Like we're not trying to ramble about looking for, what do I read and what do I not read, or what do I take or what do I not take. So that really helps. So even after using this mesh term to search, we can still go ahead and apply filters. Okay, we can apply filters. We can say we want only free full text. Note that it has reduced from 18 to 10. When we say we want just full text, that is free. And even if I want to go ahead to narrow it down, say to 2022, we have even just 2 results. So if we want to talk current guideline for essential hypertension, and between 2022 to 2024, for free full text, this is what we have. If we want to include abstracts, we have 5 results instead of 2. So this obviously has helped us to really streamline our search, and as clinicians, clinical pharmacists, and people in drug information, it's really important if a physician or a nurse or any other healthcare provider walks up to you and needs information regarding whatever. This can be applied to whatever. And since this is a global, publicly available platform, we can really take advantage of it and leverage on this, really, because it's giving us up-to-date, real-time, and reliable information to support evidence-based decision making. At this point, one more thing, how to export these results. So let's do it to the end. Like, for instance, we have gotten these 5 results and we want to take one of them. We can highlight it. Let's say free full text only, for instance. Let's take out the abstract. Okay, we have 2 results. So this is talking about optimizing the angiotensin, aldosterone to renin ratio, cutoff screening memory. Okay, let's look at cost effectiveness. I was looking for something that is relatable to our Nigerian environment. Okay, I think this makes sense. Let's say you want to provide recommendation to maybe the procurement pharmacist, and as a drug information pharmacist, they come to you to say, do you know anything about the cost effectiveness of or comparative effectiveness and safety of amlodipine and losartan in the treatment of hypertension or something? This is Bangladesh, but we could modify the search to say maybe something like in Nigeria or something. essential hypertension and guideline, let's say, and Nigeria. Do we say Nigeria? Do we have Nigerian guideline? No.
Okay,
Okay, let's
why
just
not
leave.
maybe South Africa or Ghana? South
Okay,
Africa,
Africa.
Egypt. Yes, any country in Africa. Maybe Egypt, South
Okay.
Africa, or Ghana also.
Okay, let's try Africa.
Okay.
Oh, this says no results. Oh my God. I think we depend on do we depend on the ACC AHA guideline? What do we use? I mean, tell me, because I've been away for some time. I don't know. Things must have changed. So what do we use in our facilities as per guideline for hypertension?
We
It's
use
the one published.
JNC.
Okay.
JNC.
Okay.
And sometimes ASA. American
Cardiology.
We use
AC.
JNC 7 treatment
JNC.
guideline.
JNC 7.
We still use 7?
JNC 8, you mean?
Yeah,
8.
like
We've moved to JNC 8.
yeah, I know they moved to GNC 8 in like 2017 or so. I was still doing my master's at that time. So yeah, I remember having that as an exam question. What's the difference between GNC 7 and 8? Okay. So let's just finish, like wrap up how we can export the results. So let's say we're looking at comparative effectiveness. Let's say Bangladesh. We didn't see anything for Africa. So you can play around with it and, for different disease condition or different medical terms or whatever, to just see, how it works. The more we use it, the more we get used to it. So if we click on this, or you have multiple of them that you maybe have examined, okay, let's say we want to just run through this. Yes, do you want to say something?
Yes.
Okay, please go ahead.
From the result I'm having. Hello? Can you hear me?
Yes, I can.
Okay, from the result I'm having here, the comparative efficacy hospital of Bangladesh, I'm having it as number 3, but I can see from your end there it's number 6. I don't know. Is there any something that I've done wrong? Or...
I don't think it's wrong or anything. I think it may just be based on this 2015 thing, because mine moved back to 2015. Remember, initially we moved it to 2023.
2022, actually.
Okay, 2022. So does it look like what you have now?
Let's see the number 2. I mean number 3.
Yes.
Yeah, yes,
It's now
it's okay
number
now.
3.
Yeah.
Yeah, so it's just pretty much, just this using the filter, you get different results as is optimizing the search. So
Okay,
at the top of the search page, we can click on export, I think. Let's assume we have examined and we are deciding to pick this cost, comparative effectiveness and safety. We would now move to click on create alerts. If we want to get updates when a new article is published on that topic, we can say create alerts. Let me highlight it and go here to say the top. Do we say create alerts next to advanced?
Yes, we can see it.
Yeah, if you click that, it will take you to you logging in. You can use OSEED or whichever of these accounts you have. It's free to create the NCBI account. If you click on it, it would tell you to, create an account if you don't have one, or you can simply use your Google account and I don't want to put it so I don't get the emails. I don't need it. So you can choose any of these, the OSEED account or whatever. We can go to more login options and, find a provider. I don't think this applies to, no, let's try. Our university subscribed to this because there are some universities subscribed to it. I know. Do we have faculty?
For me, I'm not really sure about that. Except those are in the academies. Possibly can help us to check.
Okay. So, okay, I mean, that's just another feature, but I think most of us have Google. That's the most common account. So if you say send to my Google account, it tells you to sign up. And then you receive alert whenever any new article is released relating to that. Oh, it took me out. Okay. When any new article is released, it gives you an alert. Also, we still have our article of interest highlighted. So we can also use the send to button. Either we say email it to somebody, or we can send to. If we say send to, we export the search results to a citation manager, like say Mendeley or something. If I say citation manager, I don't know, I think I deleted. Okay, section 1. Okay, section 1 is like the one I highlighted. If I say create file, you see it's already downloaded. It's this one, it sent it to my downloads, I guess. Yes, my downloads. And when I try to open it using the WordPad, is it WordPad I'm supposed to use now? Just once, let's see. Let me try. Okay. So do you see my screen where it shows the document I just opened on WordPad, like the citation? Does it show that? I don't think I'm sharing that screen.
No, it's not showing that.
Okay, so basically, like, I mean, we can just send to a citation manager or what's it called, word text, and copy the citation or something. And we can also say email. If we say email that result, we put our email and it sends it to us. We can just easily go there. So we can really create a library where we have, like, since we're like the DIC unit, we can create a library where we have, okay, hypertension, even arrange it to guidelines. Diagnosis is not really our thing, but if you want to, like, we can really create those kind of folders and organize it in such a nice way that when people come to seek for such information, it's easy to just navigate and provide it quickly. So we can also use the share button to share. We can save. And pretty much in all of these buttons that are here. I will now switch. This is the end of the practical section. I would like to know how it went for all of us, but right now, let me switch back. I need to stop sharing and reshare. To switch back to our slide.
Sorry, before you
Okay.
before you switch back to your slide, can you go back to the last page? So as we are now, how do we, if I just want to have a quick access to any of the articles, yeah, and I have my laptop with me, how do I just download a full text immediately into my
free full text. Let's do it right away. We can do this cost effective next one. Do we see free full text here? So PDF. Here is it. You can now download it into your laptop.
Okay.
Yeah. And then choose a folder to save it. I don't want to save it, but that's pretty much how to go about it.
Okay.
Okay.
Thank
Any
you.
other thing before I leave here to the main page? Okay, we can always come back. Let me just conclude on the presentation. I have to stop. Navigating these two screens can be a little confusing for me. I don't even know where I am right now. I want to stop sharing and reshare. I don't see the Zoom button anymore. Okay, let me just try to reshare. Do we see the?
Oh, great! Yeah,
right
yeah.
now?
Yes,
okay.
You are back. Yeah.
Thank you. So we already did all of this, and we are concluding. I'll just put it on the slideshow again. So as we wrap up, sorry, I didn't even ask how many minutes I had. I probably am overboard with time. I apologize for that.
No,
but
it's
as
fine.
thank you. As we wrap up, let's quickly have a recap of the points that we've covered. So first, we discussed the importance of PubMed as a vital resource for assessing, a vast database of biomedical literatures. We learned how to optimize our search using the Boolean operators and or nuts, and the importance of using the mesh terms to ensure we find the most relevant articles. We also covered how to apply filters such as date, range, article type, language filters, and all that to still help optimize and streamline our search. And also demonstrated how to search for hypertension treatment guidelines as an example, to help you continue learning and mastering PubMed. For those that might want to, have included this list of resources that you can access. You can access the PubMed help guide, this NCBI tutorials. Here you can really see, how to do a lot of things, probably even beyond what we've demonstrated in this minutes of the class. And the mesh database overview to better understand how to use these mesh terms and everything. So we've pretty much come to the end of this presentation. If you have questions or need further assistance, please feel free to reach out to me. I can drop my email or LinkedIn or something on the chat box. And I am very much happy to help you navigate PubMed or answer any questions after today's section. I hope you found this section valuable and it will help in some ways to enhance your clinical practice through, trying to comb evidence-based research. And with that, I would love to thank Dr. Bello for inviting me, and thank the drug information pharmacists in Nigeria, the Kwara SECAN and the Global SECAN, and everyone that is here present. Thank you so much for having me, and let's open the floor for questions and discussions. Thank you so much for your time.
Wow. Please, let's appreciate Dr. Tarile with reacting by the use of thumbs up, please. Let's react to thumbs up to appreciate Dr. Tarile. Yes, thank you so much, Dr. Tarile, for that insightful, highly informative and practical presentation. Indeed, your expertise and in-depth knowledge have provided us with guidance on how to effectively navigate PubMed and find the best evidence to support our clinical decisions. Your contribution tonight will undoubtedly enhance our practice and ultimately the care we provide to our patients. So please, before we open the floor for questions, a special recognition to pharmacists from the armed forces. I can see Flight Lieutenant A.I. Goragi and Flight Officer Sidi Ali. Thank you for joining this call. So please, the floor is now open for questions and answer. You can please use the raise hand feature if you would like to ask your questions verbally, and I'll call on you to speak. Alternatively, you may wish to use the chat box to ask your questions, and I'll read them for Dr. Tarile to answer. So please, question and answer. The floor is open. So the night is fast spent, so please let's quickly ask our questions so that Dr. Tarile will respond. Okay. Yes, please, Ahmed Sanusi, please, you can unmute and ask your question or make your contributions.
Okay, thank you very much to SIPAN, and thank you to our doctor from diaspora, Dr. Tarile, for sending back this support and giving us this guide this night. It has been really educating and fully exhaustive. Honestly, I know PubMed for long, but now it has opened a different scope for me tonight. Please, apart from this search engine, this PubMed site that is available, what other similar sites are available, similar to PubMed, that have similar implication like PubMed? I know of such like this drugs.com, and some of them. Are they really giving similar thing to PubMed, or PubMed stand alone in this respect? Or are there any similar one to it for educational purpose? Thank you.
I think I should just be responding on the go, so I remember
Yes.
them.
Yeah.
That's okay. Okay. Yes, so there is let me even get the link right now. There is Embase, there is Medline. All of these are search engines that are similar to PubMed, but the drug.com, I wouldn't say is like commensurate with what PubMed provides, because it's just drugs. PubMed is all encompassing, like everything, drug, non-drug, So I can just quickly put those other, I know PubMed is very popular. I can put it in the chat box now. Looks like I'm still
Okay.
sharing.
Okay, thank you.
Yes. Thank you.
Okay, so Ahmadu Sanusi, you can now drop your hand so that we are sure that you are done with you. Thank you. So the link to other search engine have in the chat box. Dr. Tarili had dropped them. So please feel free to check the link and you can use them. Please, we still have room for other questions, contributions. So while Dr. Tarili is dropping the link on the chat box, anybody else can, anyone who wants to ask question or make contributions can please unmute and do so. All right. It appears there are no further questions or contributions. I've looked at the chat box and they're full of appreciation to Dr. Tarili for the wonderful presentation. So thank you once again, Dr. Tarili. We're indeed delighted and very happy to have you on this call tonight. Dr. Ibrahim, please, are you there? Okay, so we'll move to closing remarks and vote of thanks. Dr. Ibrahim, are you there? Can you hear me? All right, okay, so I want to invite Dr. Ojo, pharmacist Ojo, to please help us with the closing remark and vote of thanks.
Okay. Good evening, everyone, again. We want to appreciate everyone that has been on the call from the beginning till now. Our time is fast spent. We also want to appreciate our presenter for the lucid and the practical presentation. We know that this has served to equip us, open our eyes, and to engage us as we seek to locate and get the appropriate information that would help us to present evidence-based use of medicine to our clients and to other healthcare practitioners. So we want to thank you so much. Many thanks to our presenter and many thanks to everyone that's been on the call. We look forward to seeing you again when we do put out a notice for another presentation of the DIPN. And as usual, we appreciate the support of our primary body, Clinical Pharmacists Association of Nigeria, on whose shoulders we are standing tall tonight and at other times. We also want to appreciate our moderator for the service that he has rendered tonight in coordinating the meeting and making it worth our while. Thank you so much. God bless everyone on the call tonight.
Thank you so much, Dr. Ojo, for that very wonderful closing remark. So as we bring this meeting to an end, I would like to invite one of our participants to please give us a closing prayer. So please, any volunteer, just unmute and lead us with the closing prayer.
In the name of Allah, the most beneficent, the most merciful, we thank Allah subhanahu wa ta'ala for giving us the grace and gratitude to undergo this session this night. We pray that Almighty Allah will reward our facilitator, the moderator, and DIPN, and the entire participant of this session tonight. And may He grant us all our success and all our dreams and objectives of joining this session. And we hope to unite again some other time in goodwill and in good time. And I wish all of us success and safe delivery and safe return back to our various assignments and to our various destinations. Thank you very much and good night.
Thank you so very much, Ahmad Sanusi, again, for giving us the closing prayer. So with the closing prayer, thank you all once again for your participation. We look forward to more sessions like this as we continue to enhance patient care through the effective use of drug information. Thank you so very much. Have a wonderful night rest. Thank you, thank you, thank you.
Thank you. Good night.
Thank
everyone.
you. Good night.
Bye.
Good night. Bye.